Good morning, guys. Monday morning, feeling good, starting the day bright and early. It's like 7:40 right now. I'm heading to the hospital. Feeling good. So sorry about this weekend. There were no vlogs this weekend. Feel free to subscribe. I make daily videos about my med school life. Currently on a pediatrics rotation. I'm starting week 3 of pediatrics. It's only 6 weeks long. I'm kind of sort of feeling the anxiety of the shelf exam. This is my first core rotation. I've never taken a shelf exam before, so I feel like in 3 weeks, am I gonna be ready? Am I gonna know everything about pediatrics? I don't know. Hey guys, today was a lot. It is 5:30 right now on a Monday, which is kind of late. I'm gonna try hard not to forget all the patients we had. Let's start with the first one. A 16-month-old female had molluscum, some sort of fungal infection in her genital region, right? Never seen it before, and surprisingly, in real life, it looks just like the textbook. So that was super interesting. The baby is itching, and it's so terrible to have something like that at that age because you can't vocalize what's happening. It was red, and she was scratching and crying and miserable. That same patient was also there for, she was diagnosed with bronchiolitis. Honestly, I forgot when she got diagnosed. It's in the file, but I don't just remember all of these things. And I don't actually think the parents are, not the parents, the grandmother, because the mother, when we asked about the mother, the grandmother said the mother's a loser. And I'm like, oh, okay. So I don't know if the grandmother's actually taking care of what might be bronchiolitis. And I feel like it's gonna turn into asthma. Like, they're not really, I don't feel like she's doing what she's supposed to do. We asked her about treatment and she was like, yeah, I do that. And we asked her about, she got put on prednisolone last week. We asked her if she gave her all the medication and she was like, yeah, I did that. And it's like, it's not exactly convincing. She has a follow-up appointment on Thursday because that's when the pulmonologist comes in, and probably gonna do another nebulizer treatment for her. While we're on the topic of genitals, let's go to patient number 2 who thinks she has bacterial vaginosis, 13-year-old female, not sexually active. During the exam, to me, it didn't look, oh, and also she said it smells, it has a fishy smell, but I don't think she thinks it's fishy. I think she heard someone say it's fishy, another kid is running. I don't think she exactly knows what fishy is. I think she heard it somewhere and is repeating it because she didn't come in complaining of fishiness. Or she might have overheard a med student talking or something like that. Apparently she's had that same smell since last year. So she tried yeast creams and she went to the ER for it and they gave her a yeast cream, but she said it didn't work. And, oh, thank you. And now she wants a bacterial cream, like something topical to put on there. I left before the doctor wrote the prescription, but I'm pretty sure she's gonna give her something orally, like maybe metronidazole, who knows? I can find out about that tomorrow. That's really cool. I was with the pulmonologist a lot today, so I saw a 13-year-old just for an asthma checkup. Turns out they didn't know exactly how to use the Ventolin inhaler, that's a rescue inhaler. Gave a little knowledge about that. He did the nitrogen oxide test, which was pretty good. I think it was 7, and the spirometry test, which was 8. He did better after the treatment with albuterol. I feel like I've mentioned asthma patients to you guys before, but never actually explained what goes down with asthma patients. I think when people think of asthma, they think of like the stereotypical wheezing, like the but it's not always like that. Sometimes you can't hear it audibly without a stethoscope to the person's lungs. That's how it was with the 16-month-old. You couldn't hear her wheezing without your stethoscope, and when you put it to her chest, that's when you're like, oh snap, she's wheezing. So we gave her a nebulizer treatment right there. So nebulizer treatment, you put the mask over your face and inside is the medication albuterol. It vaporizes it and you just inhale it. And what it does is, so what asthma is the little sacs in your lungs are closed. So they're supposed to be open so oxygen can go in and out. And right now they're like, instead of being like that open, they're like that. So you're not getting enough air. So what the medication does is bring them from that to that. So it opens it up so you can get more oxygen in. So that's really the reason for using the medication. And that's why it's really important that the mom uses the medication and why it's concerning that she's not using it. Not the mom, the grandmother, sorry. I think those are all the female patients I had. The male patients were all boys from like a boys' home. So I think how it's broken down, honestly, I'm not really sure. There's 2 different kind of boys' homes. There's one for criminals, like people who have done something bad but are too young to go to jail. And there's people who, I guess, they're not with their family members for whatever reason. One of my patients was going back to his house with his mother today. Besides all those kids, I had a lot of well child visits. I think I had a 12-month-old, 13-year-old, and everything else was fine. For the 12-month-old, we gave the vaccinations needed. I think I've also mentioned giving vaccines to you guys, but I haven't actually mentioned what we do and when. It's actually kind of hard to memorize, if I'm being honest. From like birth till 4 years old, we're giving vaccinations. So the 1 month or the 1 year old, the 12-month-old I had, we gave her MMR, varicella, a flu shot, and I think her Hep B. I don't remember. The thing is, at different ages, we give different shots. Some things require more than 1 dosages. Some things can require up to 4 dosages. Starting at 6 months, we start to give the flu shot. So typically, if you come to the office and you're less than 4 years old, you're most likely getting a shot. That's it, guys, or I should say that's all I can remember. I saw a ton of patients today. I think I usually tell you guys like, oh, I saw 1 patient, I saw 2 patients. Today I saw greater than 6 patients. You know, even if it wasn't my direct patient, I would go in to see other patients, to see things that I've never seen before. It's all about the learning experience. Oh, speaking of learning experience, tomorrow I'm actually going, sorry, I just checked the time for how long I've been babbling on. Tomorrow I'm going to inpatient to check on some patients that have been admitted. So I'm actually going to head to the hospital a bit earlier than usual to go down to the pediatrics floor and then go to the NICU after that, as I usually do in the mornings. So it may or may not be interesting tomorrow. Thanks for watching, guys. Thanks for subscribing. I'll see you guys next time.